It's too late to test Shelley Stahl or Amy Mathis for COVID-19.
It was just like this cough and fever, and my lungs hurt really bad.
I came back negative for the flu.
Both women say they were very sick earlier this year. For Shelley, it started before Christmas and continued into February. Videos she tried to take of her 2 children were interrupted.
The Thursday before the Super Bowl, my cough started to get progressively worse again. They tested me for the flu. It was negative. So they finally were like, we're going to do an x-ray. They did an x-ray, and there's this huge mass in my left lobe, I think they call it. And they're like, okay, you definitely have pneumonia.
I think that's, serology testing in terms of it's better to understand, the impact of the virus on our population.
Dr. Brian Hartle is an epidemiologist with the Kent County Health Department. He says they're looking into doing serology tests, which measure antibodies in a person's blood, in this case for coronavirus. It would mean that they had been exposed to the virus and their immune system fought it off.
And so it's not a good diagnostic test, but it's a good test to say who may have been infected at some point.
Amy is very interested in a test like this. Her trip to Vegas in February was ruined by an illness she now believes was COVID-19. So when did it first dawn on you, you know what, I think that's what I had?
When they started listing the symptoms, and I pretty much had all of them. I had trouble breathing, sore throat and headache were the first things, and then I had a fever of 101.3. I thought, well, why do I have a fever? I don't have the flu. What could it be?
Labs in West Michigan aren't currently offering antibody tests and don't have a timeline for when they might be available. The FDA has only given emergency authorizations to the Mayo Clinic and Cellex, a company based in North Carolina. In the next month or 2, you may be able to take a test at home through Scanwell Health. Doctors there are waiting for approval from the FDA to offer a mail-order kit. You would do a finger prick and then upload the results through the app. Positive or negative, those results could answer many questions.
Just out of curiosity, it was her and our brother-in-law, he was sick, and then our sister-in-law, when they got back from down there, she went to urgent care too.
I think it would help me feel like, it's just kind of like, okay, I already had it, so I know I've built up a little bit of immunity.
These tests could be useful for a number of reasons, including possibly getting people back to work if they know they may have some immunity. Private practices are able to start offering these tests due to looser restrictions from the FDA while they wait for full approval, and we're going to start seeing that more in the coming weeks. In Grand Rapids, I'm Teresa Weekly for News 8.